Hey everyone, it's Dr. Deborah Guevara. Thank you for taking time out of your day to listen to my presentation, A New Look at Peripheral Neuropathy. In my practice, what I've found is that those of you who suffer from chronic foot and hand pain often feel unheard, ignored, and left out. You're sick and tired of the pills that don't work and being told it's all in your head, or just live with it. How many of you have experienced this or something similar? How many of you feel that other people don't understand your pain, even your loved ones? Is there anyone here who feels their doctors just don't get it? You want to live pain-free, or at the very least have more pain-free days? You want to go for walks with your loved ones and play with your children or grandchildren? Instead, you believe that your doctors aren't doing enough, that there's no hope for you, that you're condemned to taking medicines for the rest of your life. You continue taking painkillers and depression drugs you don't want and really don't need. Your dosages keep going up, but your pain is still there and you're still miserable. Actually, what you really want is to find a way to conquer your pain, to be able to take control of your life again. Let me tell you a story about myself. When I was young, I began experiencing pain throughout my entire body for no apparent reason. I was always hurting, feeling miserable, depressed, tired to the bone. I hated exercising because I only hurt worse and the pain kept me up at night. This went on for years. I consulted several doctors and they just gave me sleeping pills, antidepressants, and pain medications, which I refused to take. When I turned 40, I had to have knee surgery, and my orthopedic surgeon diagnosed me with fibromyalgia. I was so excited to finally know that my pain was real when the doctor turned around and gave me the same medication everyone else did and told me to live with it. I was furious, but didn't have a clue as to what to do. Several years later, I decided to go to chiropractic school, where I started learning about nutrition, exercise, and spinal alignments. I soon noticed that my pain had started diminishing, and along with the nutrition, exercise, and regular adjustments, my energy was back. I lost weight and I felt better. I was a new person. Now I no longer suffer from constant pain, and the pain I do have is manageable. I sleep throughout the night without pills or any kind of pain medication. I rarely even have a headache. Now I understand that I don't suffer from the same condition as you. But I do understand your pain and frustration of not feeling listened to and no one addressing the underlying problem. I was lucky. I found the information I needed to address my pain, and I feel that if you too find the data you need, you can also conquer your pain. I feel that it is my mission as a chiropractor to help others who suffer from chronic pain to discover ways in which they can conquer their pain and suffering as I did. I'm determined to help you stay active, healthy, independent, and pain-free well into your senior years. There are 3 secrets which I'm going to share with you here today that you need to know if you or your loved one is experiencing neuropathy. First, let's define neuropathy. Neuropathy is a damage to or disease affecting nerves, which results in impaired sensation, movement, gland, or organ function, depending on the type of nerve affected. Who gets neuropathy? Anyone, but especially those people who have underlying health conditions such as diabetes, heavy metal exposure, alcoholism, chemoradiation therapy, and the list goes on. According to Peripheral Neuropathy Fact Sheet, NINS, August 2018, approximately 60 to 70% of diabetics will develop neuropathy. But diabetics makes up only a small percentage of the people who suffer from neuropathy, which means the others are either from other sources or are unaware they are at risk. A study published by the Neuropathy Association in 2009 found neuropathy is often misrepresented as only being diabetes related. However, this survey demonstrates that for every diabetic neuropathy patient, there are at least 6 more patients suffering from other various forms of neuropathies. Some of the more common sources include radiation or chemotherapy, B12 vitamin deficiency, nerve damage or entrapment from trauma, side effects of prescribed medicines, malnutrition, and HIV. They view their numbness, tingling, burning, and pain to be something they should just put up with or ignore. Even though you may not know the source, everyone who suffers from numbness and tingling should seek treatment because it only gets worse. A report in the British Medical Journal provided this statement, showing that 75% of patients who do nothing about the numbness and tingling will suffer from either pain or disability within a year. Secret 1. The one thing everyone is sweeping under the rug is the reason you haven't broken free from your neuropathy nightmare. The one thing that no one is telling you is that medication alone doesn't improve your neuropathy. It does nothing to regenerate your nerves and rebuild your neural pathways. All medication does is mask your symptoms so that you are more comfortable while your nerves die and your function decreases. People on medication alone have marked increases in falls as their neuropathy progresses. Medicating the symptoms is like taking the battery out of your smoke alarm to stop the noise. Your pain might be gone, but the medicine just masks a slow loss of nerve function, which could impair your capacity to maintain good balance. The next thing you know, you've fallen and broken some ribs, or worse, your hip. Some of the more common neuropathy drugs, such as Lyrica, Pamelor, Cymbalta, gabapentin, all have neuropathy listed as side effects. Just think, you're now taking medications that not only mask your symptoms, they actually make them worse. Secret 2. This little known secret to reducing the pain and numbness of neuropathy, combined with the right methods of treatment, will allow you to experience less pain and debilitation in only 3 short months. Research studies published by Harvard Journal of Advanced Research and PMR all show that peripheral nerves can be regenerated using low-level laser therapy. They show a substantial decrease in pain and nerve regeneration when used consistently over a 4-week study. Neurotropic foods, which are rich in B, D, and E vitamins, also help regenerate your nerves. These nutrients provide the building blocks for your nerves' regrowth. Incorporating these, along with dietary changes and a nerve stimulator in your life, can decrease your pain and improve your mobility significantly in only 3 months. The key to beating your neuropathy is not just getting rid of the pain. There are drugs that can do this. The key is rebuilding the neural pathways to your limbs so that the pain, numbness, and tingling actually go away and aren't just masked. The crucial goal is preventing serious falls because you can't feel your feet, which medications don't address. What else are you going to do? You can't just let it go and hope it gets better, because it won't. Your nerves will degenerate, and pretty soon you won't be able to recover your sensation. Then you will be confined to a walker, or even worse, a wheelchair. Secret 3. Our solution to neuropathy doesn't involve more pills, a lifetime of pain, or being told to live with it. My program is made up of 4 components which I consider to be the backbone of getting better from neuropathy. These are nutrition and diet, therapies, exercise, and chiropractic adjustments. Nutrition and diet are vitally important to your nerves' recovery. Eating foods that are high in neurotropic properties and using a daily neurotropic supplement will help feed the nerves and rebuild your neural pathways, resulting in less pain and more sensation and less likelihood to fall. Therapies such as low-level laser therapy, nerve stimulation, vibration therapy all work towards regenerating your nerves, increasing your sensation, and maintaining good balance. Exercises specific to neuropathy and balance are taught to help stimulate your new neural pathways and build proprioception so that you don't have to risk falling. Chiropractic adjustments help the brain and nervous system maintain communication from the brain to the nerves in the body, ensuring that the signals reach their destination unimpeded. This leads to less pain, better balance, and better overall health. Now, you may think that you could do all this on your own, and you can, if you know enough about nutrition and diet, can invest in buying the equipment and learning how to use it properly, know which exercises are more beneficial and then learn them correctly, and implement them in your daily program, and get a proper adjustment for your condition from a licensed chiropractor. It took experts who know this body inside and out over 3 decades to formulate methods and conduct studies to develop the equipment used for therapy, the exercises pertinent to your condition, the dietary requirements for your body's recovery, and doctors like me years of practice to combine the research together to come up with the exercise, diet, and therapy used in this treatment protocol. You could also hire a nutritionist, dietitian, exercise therapist, find the equipment sources, research and buy your supplements, and hire a chiropractor who specializes in neuropathy. You may save a little money, but will you get the same quality care? You can go to your doctor, get a battery of tests to diagnose your neuropathy, and take prescription medicine for the rest of your life. Or you can have the program done for you. It just depends on how much time, effort, and money you want to spend. You can do this on your own if you have the time, money, and fortitude. But do you really want to? Do you want to run the risk of hurting yourself without professional supervision? You need help. You need a system developed by a doctor that addresses all your needs in one complete package, which includes professional supervision, equipment, cookbook nutrition guide, exercise instruction, and chiropractic adjustments. You don't want to spend a decade learning what I've learned, but you want the results I've achieved and helped others achieve. A number of studies have been performed that show the viability of low-level light therapy in peripheral neuropathy. According to expert review of neurotherapeutics, substantial numbers of experimental studies have shown phototherapy as a supportive factor for accelerating and enhancing axonal growth and regeneration after injury. Furthermore, its beneficial therapeutic effects can be obtained without undesired side effects. The Journal of American Podiatry Medical Association stated, therefore, MIRE may be a safe, drug-free, non-invasive treatment for the consistent and predictable improvement of sensation in diabetic patients with peripheral neuropathy of the feet. Another therapy I use is a nerve stimulator, on which U.S. pharmaceutical studies reported. Initially and at the end of 10 treatment sessions, the average pain level was calculated. Observations indicate an average reduction in pain by 27.35%, an increase in quality of life by 81.14%. A decrease in symptoms was reported by 95.76% of patients, and 74.56% of patients felt immediate relief after the first session. Let me tell you a story. I had a patient a few years back who I was treating for neuropathy caused by an injury. He had mostly lost all his sensation in his feet and had a difficult time walking. He started my program in January and was very diligent doing his exercises, getting treatment and adjustments, following his diet, and taking his supplements. One day in May, he called my number, and when I answered, he was very excitedly told me he was at the grocery store getting his groceries. I responded with, "Okay, and why are you calling me?" He said, "You don't understand. I've been walking around the store for 2 hours." I asked, "Why?" He responded with sheer giddiness, "Because I can feel my feet." Look, nothing I'm saying here is brain surgery. What's the real reason you aren't doing this even though you know you should? What is this really costing you? Money, time, freedom, independence, self-esteem? Write it down. How much is it worth to you to be out of pain and mobile? Everybody, take a deep breath. What will your life be like when you solve this problem? Can I show you how to walk the grocery store, or around the park, or across Europe? Can I show you how to live with less pain like I am? Can I show you how I can help you do these things and more, once and for all? Once you have completed my plan and are on the road to recovery, you'll once again have the freedom to take a walk with a loved one, go on that dream vacation, play with your kids or grandkids. You will start feeling your feet and hands again, stop worrying about your balance, avoid needing a walker or wheelchair, and you will maintain your freedom. Having a program like this addresses all the common problems of neuropathy: loss of feeling in the hands and feet, loss of balance, pain, and loss of freedom. This has worked for others because it is a holistic approach to neuropathy and provides supervised, accountable care. Thanks for listening. If you have any questions or would like more information, you can contact me at ghcdeborah@gmail.com or www.gentlehandschiro.online.com. Now, I just want to thank you all for the time commitment you made here today and leave you with this one last thought. Your body is the most priceless possession. Take care of it. From the late, great Jack LaLanne.